Good day everyone, I am Althea Angara Sasnawi, a student nurse from Davao Doctors College. I came from BSN1 11L, and for today, I will show you my return demonstration in getting vital signs of the patient. Accurate measurement of vital signs is critical because it reflects body basic functioning. It serves as baseline data which allows us to track changes in patient's condition, recognize early patient deterioration, and prevent harm or errors that may occur. Vital signs include temperature, pulse rate, respiration rate, and blood pressure. Paraphernalia needed are digital auxiliary thermometer for patient's body temperature, stethoscope, and sphygmomanometer to measure patient's blood pressure, a watch with a sweep second hand to measure patient's pulse rate and respiration rate. And lastly, alcohol to avoid contamination and disinfection. Prior to performing the procedure, introduce yourself and verify the client's identity using agency protocol. Explain how she can participate in my vital sign assessment. Without further ado, I'm going to do my return demonstration. Okay, hi ma'am, good morning, how are you?
I'm fine, thank you.
That's good to hear, ma'am. By the way, I'm Althea Angara Sasnawi, your student nurse for today, and I will be getting your vital signs. And before anything else, I want to see your wristband and state your name and birthday, please. Okay, ma'am, kindly state your name.
My name is Tanya Canubas.
Birthday, please.
June 6, 2004.
Okay, ma'am, thank you. So ma'am, before I start the assessment, I need to do hand hygiene and put my gloves, ma'am. This is to prevent the microorganism to contaminate between me and my patient. So I will just put my recorder here and get my alcohol to disinfect my hand. And after that, I'm going to wear my unsterile gloves. This is the unsterile glove that I'm using. And adjust it in your fingers or hands. Adjust in the middle of the and in my non-dominant hand I will do the same. Just be careful on putting your unsterile gloves because it might be it may tear and you will get microorganism coming from the patients while performing the procedure. Now that I'm done with my gloving, I'm going to get the patient's temperature. The temperature is very important because it reflects the balance between heat produced and heat loss of the body. In taking temperature, I will be using oral and auxiliary site, but first I will be doing the oral. Ma'am, I am going to close the door for your privacy. Do you want me to adjust the room temperature and the light?
No, it's fine. I'm comfortable with it.
Thank you, ma'am. After that, I'm going to get the thermometer and wipe the tip of the thermometer with alcohol, swab in a firm twisting motion prior to the placement. I have here my thermometer and I have here my wipes which has a alcohol, and I'm going to whip the tip of the thermometer in a twisting motion prior to its placement. After that, I'm going to discard the alcohol that I used in my trash bin to prevent the microorganism to and for us to be contaminated with it. Now I'm going to place it on the posterior sublingual pocket of my patient's mouth. Okay, ma'am, please open your mouth and put the tip of your mouth in the... Okay, kindly close it. Okay, we'll just wait it to beep to get the oral temperature of the patient. Okay, ma'am. Please don't laugh because this is a serious procedure. So your temperature is 36.8, which is within a normal range. So after that, I'm sorry for the disturbation of my client. So her temperature is 36.8, which is within the normal range. Now, I will disinfect the thermometer that I use and document the data that I have gathered. So I'm going to disinfect again the thermometer that I use in a circular motion, and don't forget to document the data that you've gathered. After that, I will disregard the alcohol or tissue that I've used and put the thermometer back. And after that, I will discard my gloves. And discard it in the trash bag. After that, the next thing I would do is to get the temperature through the axillary site. I'm going to pull up your sleeve so I can put the thermometer. But first, I need to look or see for any scars or lesions and pat dry the area that are most dry. Alright, ma'am, I'm going to put your sleeves up and check for cuts or lesions. So I can see any of the cuts or lesions, but I will pat dry the moist area so that the thermometer will. Okay, I will disregard it again. And I will get the thermometer back and put it in the axillary and just wait for the thermometer to beep to get the patient's temperature. Okay, ma'am. Okay, ma'am. Let me check again. Let me just adjust it, ma'am, for a while. Okay, ma'am. You can close it now. So let us just wait for the thermometer to beep to get the patient's temperature. Okay, ma'am. Your temperature is 36.8, which is within the normal range. So again, I will disinfect the thermometer. We'll disinfect the thermometer in a and then disregard the tissue that I use, and then don't forget to write it in the patient's patient paper, so that you will be guided in the assessment later. So the next thing I will do is I'm going to disinfect the thermometer, which I have done, and I will use alcohol again to perform hand hygiene. Again, this is for the microorganism and for us not to be infected. So now I'm going to do going to get the peripheral pulse. Alright, ma'am, the next thing I would do is to get the peripheral pulse, and the peripheral pulse rate is a measurement of the heart rate, or the number of times of the heart beats per minute. This is to find out if the heart rate is normal or not normal. Hand hygiene to eliminate microorganism, it is very important. So again, let us do hand hygiene using the alcohol. Okay, ma'am. Kindly sit properly and put your elbow on the armchair. Yes, please. Thank you. After that, I will put 2 fingers in your wrist, if it's that okay, ma'am.
Okay, go on.
Okay. What I'm going to get in here is I will get the pulse rate, and I will identify if it's in the normal range. Alright, ma'am. Now I have get your pulse rate is within 60 beats per minute, which is in the normal range, and I did not observe any abnormal rhythm, and volume and your the skin color is also normal too. After I took your pulse rate, I also count your respiratory rate, which is 18 beats per minute, and good to know that it is in the normal range. After that, I will document what I have got in the patient's chart. Okay, I have put the final assessment for the respiration in my client's chart or patient chart. Now I need to get the blood pressure, and now I will be obtaining the patient's blood pressure. It ensures that the equipment is intact and functioning properly. Check for cuff size and leaks in tubing between the cuff and sphygmomanometer. Make sure that the client has not smoked or ingested caffeine within 30 minutes prior to the measurement. So ma'am, I need to ensure that you don't take or smoke within the 30 minutes or drink with a caffeine drink.
Yeah, I did not.
Okay ma'am, thank you. Before I start the assessment, I have to do hand hygiene again using the alcohol to eliminate the microorganisms. So again, I'm going to get our alcohol and do a proper hygiene to prevent the microorganisms to contaminate me and my patient. After that, now I have done my proper hand hygiene. I will tell my patient, ma'am, can you sit properly? Make sure that your feet is on the ground, and can you put your hand in or the elbows on the armchair? Okay, ma'am. After that, wrap the cuff evenly around the upper arm, locates the brachial artery. Okay, I will get my sphygmomanometer. And then, and put the cuff. I'll just do this one now. And put the cuff in the arms of my patient, and I need to put it around the upper arm and locates the brachial artery. This is your brachial artery, ma'am, and I'm going to put the cuff in here and make sure that it is after that, I'm going to put this one in the top of the, and after that I'll put this, and I will find the pulse of my patient by these two hands. Okay, now that I find the pulse of my patient, I'm going to get my stethoscope. And I'm going to clean the ear part of this with a alcohol to disinfect. It is very important to disinfect everything that you use. I'll just disinfect the ear part. And I'll make sure that you put properly your stethoscope and check make sure that it is functioning. Then after that, I'm going to put it in the artery of my patient. Achilles declines blood pressure, pump with cuff until the sphygmomanometer reads 30 millimeter of mercury above the point where the brachial pulse disappeared. I'm going to get the blood pressure of my patient now. Now I will just lock this, and now I'm going to pump. And take note that you don't need to use your thumb because there's a pulse running in here, so you need to use your two fingers here. So ma'am, I'm going to pump now. And then, after when you get there, you will slowly Okay, ma'am, your blood pressure is 110/80, which means that it is in the normal range. I will just put it here. And I will get my stethoscope to clean the ear part of it. It is very important to clean every paraphernalia that you use so that it will be disinfected. And don't forget to discard your used or contaminated tissues. And after that, I will write in the patient's chart now that I documented, I have now my summary and closing phase. Okay, ma'am, I will summarize the data that I've gathered. Your vital signs are normal. I observe in overall assessment that your temperature is 36.8 degrees Celsius, which means that it is in normal range. Your pulse rate is 60 beats per minute. It is normal. Your respiratory rate is 18 breath per minute, which means it is within the normal. And your blood pressure is with 110/80. I encourage you, ma'am, to avoid excessive or heavy activities. Eat healthy foods and drink water, and do regular exercise to maintain your vital signs within the normal range. For now, ma'am, do you have any concerns, questions, or clarifications?
Not so far. Thank you for the proper checkup.
Okay, none? Okay, thank you for your cooperation, ma'am. That is all for our assessment. Have a good day, ma'am. So after you said your assessment, don't forget to do a hand washing and disinfect your hand or do hand hygiene. Always perform it before or doing a procedure. So I'm going to do my hand washing for our closing remarks. So I think that's it. We're done. We're done for our return demonstration. Again, I am Althea Garas Asnawi, a student nurse from Davao Doctors College, and I am from BSN 1 11L. Thank you for watching.